This morning when Shawn and I were talking about you being a guest, Jared, or Dr. Wallen on our show, um, the oxymoron of this is that really at least 30 to 50 years ago, we weren't in this position.
Right.
Doctors and surgeons and physicians were all more in a control of our healthcare system. So do you perceive that as being one of the biggest problems? I mean, that's kind of how I identify it, but what is that really what's kind of driven us into the corner of not being able to provide that care?
Yeah, absolutely. I mean, the fact that again, as a W-2 employee, I'm beholden to whoever is the CEO or what have you. Back in the 80s and prior to that, physicians were their own independent small businesses, right? And so then I'm the ultimate decision maker, not some business type or what have you, or some ex-clinician who's now a business type. And over that time period, there's been multiple different pieces of legislation, and the Citizen Health Group with John Chamberlain and Brendan Hodge, they've made a nice graph where basically they document the legislation and they document the growth of administrators, which has been like 3,500% 4,500% growth in administrators since the 80s. So, managers, middle managers, all these different layers of management for this corporate medicine conglomerate, right? Whereas physician growth is like a stagnant line at the bottom. And you see that, the cost has kind of mirrored the growth of administrators at 3,500% since then. And so, not only does that drive up cost, and I would personally argue at the end of the day, think about it. If you took away all those physicians, all 1 million of us in the country, or 1 million plus, I guess, but if you took us all away, none of those middle managers or management could actually deliver you any possible value as a consumer of medical care. And so, from that standpoint, they're telling me what to do when they don't even know what the best thing for the patient is, based on mostly financial decisions, right? But they're also essentially, to some extent, kind of controlling, what I can and can't do, or how I can and can't help patients. Not only that, but from a business standpoint, if I'm an independent physician practice, small business, I can say, hey, listen, I'm going to give you a discount, or I'm going to, comp your care. Whereas as a W-2 employee, you just can't do that. And so, right. That's where, even some of these let me make sure I get it right. These tax exempt nonprofit hospitals, right?
Right.
Even some of them, they own collection companies. And
right.
So it's crazy. Look, Marty McCary in his book, The Price We Pay, talked about how in the state of Virginia in 2017 alone, there was only 37% of the hospitals that actually sued patients. But of those, they filed 20,000 lawsuits in the year 2017 alone. And so, from that standpoint, I'm not saying that we can comp everything. It shouldn't be free. It can't be free, because at the end of the day, somebody is paying for it, whether that's out of tax dollars or what have you. We all have to, we talk about skin in the game and kind of taking accountability and responsibility for your health to some extent. But yeah, the corporatization of medical care has certainly not only disempowered patients, not only disempowered their clinicians, their healers, but it's driven costs through the roof.
Well, and just because somebody is nonprofit doesn't mean that they're out there for the good of the patient. And like you say, they are suing patients, and it's like they shouldn't maybe write everything off. I get that, but when the price is jacked up tenfold what it really should be, and they're sending patients to collection and suing them over their bill, there should be some kind of middle ground for sure, especially if they're doing this in the name of charity, which, as John Chamberlain will tell you, who is a former hospital administration, it has nothing to do with charity. It's all about bottom line to hospitals: profit, nonprofit, public, private. They're pretty much all the same.
Well, and those nonprofit hospitals are supposed to be delivering more charity care, right? But those
right.
tax exempt hospitals, but they're actually delivering less than private and public hospitals. And on top of that, again, they're sending people collections. I would argue actually even more than 10x, 23x is, I think, what Marty McCary mentioned in his book, The Price We Pay. And you think about that. If you have to pay 10% of $1,000, that's pretty manageable, right? But if you're talking about the same service at $100,000, paying 10% of that, I mean, again, for most people, that's not even in their realm of possibility. Right. And so that's where the markup discount game that a lot of retailers play is being played by insurances and hospitals together. They play this game together because they benefit. And not only that, remember, they're also hiding their prices, right? Because, I mean, yeah, there's been an executive order by Trump, which was reinforced by Biden. But ultimately, I think only like 14% of the people that are of the hospitals that have been kind of reviewed in certain subsets of I think it was of 1,000 hospitals by a patient right advocate. I mean, only 14% are actually in compliance. And that's because they can make a heck of a lot more money by hiding their prices and jacking up the prices. And I mean, I think just a specific example, the Medicare allowable payment for a joint replacement is $13,000. There's 1 in 6 hospitals in the United States that are charging $90,000 plus. Oh. And there's some that are charging $115,000 for it. And so again, and the problem also is, again, there's and medicine right now is anything but a free market, right? And so because of that, because of the regulations that are out there, the limiting of competition, these big conglomerates, the big hospital systems, the big health insurance companies are able to kind of just take over the market and do what they want. Whereas if it was a free market and we could compete, I mean, certainly everybody would probably choose, the lower cost if they understood what was going on, right?
For sure.